Mortality increases with Omicron with increasing age. We have some data from some countries that show this. We also have data from some countries that show that people with at least one underlying condition are at an increased risk of hospitalization and death, even if you have Omicron. Even though we do have some information that Omicron causes less severe disease than Delta, it's not a mild disease. It is not just a mild disease. And this is really important because people are still being hospitalized for Omicron. As Omicron spreads and as Omicron infects people who have underlying conditions, who are of an older age, and certainly who are not vaccinated, those three groups of individuals have a higher risk of developing severe disease. And what we are seeing is hospitalizations are increasing. And so the sheer volume of cases results in higher hospitalizations. Plus, as Omicron enters and circulates among vulnerable populations, we will see increasing hospitalizations and deaths. So please, treat this virus as seriously as it needs to be treated. It's not to scare anybody, but the narrative that it's the common cold is not true. The narrative that it is just mild is not true. So we have to really fight against it. It's not the time to give up. Vaccination is saving lives. You are much better protected against developing severe disease, needing hospitalization, or dying if you are vaccinated. So get vaccinated when it's your turn. All of us need to be advocating for vaccine equity around the world. It's not just about you and you having access to the vaccine, and even just your loved ones. Get vaccinated when it's your turn. But we have an entire global population. I was looking at the data today, and it's something like more than 3 billion people around the world have not had access to their first or second dose. That's a huge number of people around the world. And there should be much more outrage that's out there. This is a global problem needing a global solution. And vaccination is a right. People should have access to this, and particularly those who are most vulnerable, because we are in this together, whether we like it or not. We will not end this pandemic in one country at the expense of others. So I think that's something that we really need to hammer home. We've heard a lot of questions. I've had a lot of people say, well, why bother? Omicron is everywhere, and I might as well just get infected now. That's a very dangerous question, and it's one worth answering. The reason we don't want this virus to circulate is, number one, your chance of developing severe disease is real. If you have underlying conditions, are of an older age, if you've not received a vaccination, you could die. And that's what we want to prevent, and we can prevent that. But you can also pass the virus to somebody else who is more vulnerable. We are just learning about post-COVID condition, long COVID. We don't know the implications of Omicron, which replicates in the upper respiratory tract as opposed to the lower respiratory tract, and if that has any implication on your chances of developing longer-term effects. So that's reason enough not to get infected. But there are so many unknowns about this, about an acute infection as well as long-term effects, that it's really, please, be careful. I've heard some very scary stories about, parties of people and trying to get infected. Please, that is very unsafe. We are working very hard with all of our partners around the world to give you advice to avoid exposure, to reduce your chance of getting infected, you reduce your chance of passing the virus onward. This is critical right now. We are not talking about shutting down societies. What we're talking about is increasing coverage of vaccines, making sure people have access, as well as simple measures to keep yourself safe. Distancing, working from home if you can, and many people have found through this pandemic that you can. Access to testing, wearing of a well-fitted mask over your nose and mouth, avoiding crowds, improving ventilation. We're in a very well-ventilated room right now, but investing in that where we live, where we work, where we study. So all of those things matter, that layered approach. So please do what you can to avoid infection.